Hi, my name is Steve Harden. I'm the CEO and founder of LifeWings Partners, and this is another edition of the LifeWings Leadership Lab. Today we're talking about checklists. Checklists are one of the most important tools that you can have in your toolbox as a healthcare leader. Unfortunately, checklists in healthcare are generally not done very well. They're deceptively easy, and it's easy to make lots of mistakes implementing and using checklists, and so you don't get the full value and the full benefit of the checklist that you've invested in. So today's lab, I'll offer 7.5 tips to improve the checklist you use as a leader in healthcare. All right, today we're talking about improving the checklist that you use in your healthcare organization. Again, it's one of the most valuable tools you can have in your toolbox. Unfortunately, checklists are just not done very well in healthcare. So today we're going to offer you a checkup for your checklist. I'm going to give you 7.5 tips to improve your checklist and ensure that you don't make the mistakes that I typically see in a healthcare organization. So tip number 1, your checklist should be user-built and maintained. Honestly, as a leader in the organization, you should not be building the checklist that your physicians and staff use. Your physicians and staff should build the checklist they're going to use. Yes, this is a much messier and more complicated way to do things, and it's going to increase the time you spend on checklists because you're going to have to give them the right resources, give them the time to invest in creating and tweaking the checklist that they use. That's just messier and more complicated, but on the back end you'll be so much happier because you'll have a checklist where you have the buy-in already built in. People that have created the checklist that they ultimately are going to have to use have much more buy-in and investment in the use of that checklist. So if you want more buy-in and you want more compliance with your checklist, and you want a more effective checklist, have the people who actually have to use the checklist build the checklist. So checklists should be user-built and maintained. Tip number 2, keep it simple and keep it short. Not everything you do needs to be on a checklist. In fact, this is counterproductive. Here's an example. I fly the MD-11 for a major air carrier in the United States, and to prepare the cockpit to start the engines, I have to actually look and verify and cross-check about 90 items. But when we get to actually running the before start checklist, there's only 11 critical items. So out of the 90 that I do, I really only cross-check 11 of them with a checklist. Now, how did those 11 get on the checklist? Well, those are things that if I forgot to do them would cause some sort of harm to the airplane or harm to us before we caught the fact that we missed them, right? So really the only things that should be on your checklist are those items that if you miss them, you're going to cause harm to the patient before you figured out you missed them, right? So only the critical items go on your checklist, so keep your checklist short. And just down to step number 3, and that is checklists are not audit tools. Don't confuse your checklist with an audit tool. You know, in 40 years of doing checklists in professional aviation, I have never once filled out one tick box. I've never made one check mark in a tick box in 40 years of running checklists in aviation. A properly constructed checklist is a scripted conversation between the members of the team with a built-in cross-check of critical items. A scripted conversation with a built-in cross-check of critical items, right? So tick boxes in a scripted conversation are counterproductive. They just slow the conversation down, and that frustrates your team, and they're not going to like doing checklists when it slows down their workflow, right? So get those tick boxes off of your checklist. Now, I'm not saying that tick boxes on audit tools are not a good idea. So if you do need to go audit something and you want a checklist for the audit of it, by all means put a tick box on there, but don't confuse an audit tool with a checklist, because those two things are completely different. All right, and that takes us down to number 4 is a properly constructed checklist should have multiple speaking parts. So if a real effective checklist is a scripted conversation with a built-in cross-check, every member of the team ought to have a speaking part in that scripted conversation. When I go and watch timeouts in most surgical services units, it's really a show that's run by the circulator. He or she spouts off a bunch of information. It's kind of a speech, and you can tell by watching the rest of the team that they're not really paying attention. They're multitasking, they're not engaged, and they're not mindful. And really, all they're doing is listening for the noise to stop. And as soon as the circulator stops talking, they all say, I agree, right? That is not a scripted conversation with a built-in cross-check. Because you can tell people are not paying attention, they're not engaged, and they're not mindful. Well, if you want to turn that around, make it like the dialogue in a play, right? So every actor in the scene has a speaking part, right? And they have to pay attention to what other people are saying so that they'll know when they're cued for their line, right? So if you want people to be engaged and mindful, and an effective checklist is a scripted conversation with a built-in cross-check, then everyone that's on the team has to have part of the conversation, right? And so they have something to say about some part of the procedure that they have checked and verified before it begins. So make sure you have multiple speaking parts. Well, that takes us down to number 5, and those two, 4 and 5, are related, is if you're going to have multiple speaking parts, then the language you use has to be very precise, has to be really standard. And just like the dialogue in a play, actors have very specific lines, very specific words they're supposed to say. Well, that's also true in a scripted conversation with a built-in cross-check. For instance, let's say in your pre-procedure checklist, your timeout, you want to verify the patient's images, right? So there's either an X-ray or maybe a radiology film, and you want to make sure that's available for the procedure, right? So you might have an item on your checklist called images. So the circulator would call out images. Well, the person that responds to that call out, what is it that you want them to say? Hey, we've got them, or they're all here, or we've double checked them. What is the language you want the responder to that checklist item to say? You might want to use something like this: available and checked. So available means the images are here. Checked would mean we've ensured that they're for the right patient, the right body part, for the right procedure, and that they're displayed correctly and they're not on the screen upside down and backwards. Okay, so what that would mean is the responder to the checklist item of images would not say available and checked until all of those items had been, in fact, verified and checked, right? So we use very precise, very standard language in this scripted conversation with a built-in cross-check. So that takes us down to step number 6. Effective checklists are physician-led. Now this one has an asterisk on it because not all checklists involve a physician. But if a physician is involved, as the team leader, the physician should lead the checklist. Leading the checklist means they initiate it and they finish it. It does not mean they have to run every step in the checklist. That's especially in surgical services. That's the purview of the circulator. But the team leader, the surgeon, should initiate the checklist, call for the checklist, make sure the checklist gets started. And quite frankly, this is consistent with high reliability operations in commercial aviation on the flight deck. As the captain, I initiate the checklist when I want to initiate them. I use the initiation of the checklist to manage the workflow and to manage my team. And it's just part of being a professional in the use of checklists. So if your checklist involves a physician as the team lead, the physician should initiate or lead the use of the checklist. This takes us down to item number 7, know cookbook medicine. Hey, I hate cookbook aviation. Physicians and nurses hate cookbook medicine. There's really only two ways to design a checklist. A checklist is either a read and do or a read and verify. All right, so read and do means I read an item on the checklist and then I do it. I read another item on the checklist and then I do it. I read another item on the checklist and then I do it. This is very cumbersome and your staff will not enjoy using checklists if you insist that your checklists are read and do. In high reliability organizations and in your organization, you should design checklists that are read and verify, meaning you're going to do whatever it is you do from memory. You know what needs to be done to provide care to your patients. You have that memorized. But a read and verify checklist means that at an appropriate pause in the workflow, at an appropriate moment in the workflow, just to ensure that we've got everything done, we're going to take a short pause and we're going to read over the critical items and verify they've been done by use of a scripted conversation with a built-in cross-check. We're not going to read an item and then do it, read an item and then do it, read another item and then do it. We're going to do it from memory and then pause when we need to verify only the critical items have been done using a scripted conversation. So no cookbook medicine. All right, so there's 7 tips. I promised you 7.5. What is the 7.5 tip? All right, 7.5. Teamwork and communications training. A checklist really is a technological tool to address a cultural issue. And the cultural issue is, do you have a culture of safety or a culture of accountability where your least experienced team member can speak up and have a stop the line conversation with your most experienced team member when they perceive a problem with patient care, and especially if they perceive a problem with the checklist. If you don't have a culture of accountability, which means you have a sense of psychological safety that it is okay for inexperienced to speak up and stop the line with experienced, you're not going to get the full benefit of your checklist. No matter how well you design your checklist, it's ultimately human beings that are going to use it. And human beings make mistakes. We're going to skip steps, we're going to combine steps. Sometimes we even forget to do the checklist altogether because we're human and we get in a rush and we're under stress. And if you don't have that culture of accountability, you haven't done some sort of teamwork and communications training through team steps or crew resource management or CUS, you haven't worked on giving your team the skills on how they talk to one another when an item is missed and when they perceive a problem with patient care, you're not going to get the full benefit of your checklist. So a checklist is a technological solution really to address a cultural problem. So checklists are really effective and you get the most benefit from them when you're using checklists where there is a culture of accountability, and that comes from teamwork and communications training like team steps. All right, so your action step in this leadership lab is to take one of the checklists that you're currently using and examine it through the lens of these 7.5 steps. If you'd like to go deeper, I highly recommend a book by Atul Gawande. It's a surgeon who was involved in the original creation and implementation of the World Health Organization Safe Surgery Checklist. He wrote a book called The Checklist Manifesto. It's a quick read. You're going to love it. It really goes into the philosophy and reason why checklists work. If you're a leader in healthcare, it really needs to be in your leadership library. It's in mine. I highly recommend you go out and buy it and read it. You're going to love it.